Hello, welcome to the channel Nursing in Handy. Today we will be seeing about preventive pediatrics and review of immunization. So when we consider about the preventive pediatrics, the nursing care on the pediatric population starts from the 0th day of the conception to the adolescence. So why we have to care, that means extra care to the pediatric population means because there was a time there was increase in mortality and morbidity rate in the pediatric population, and in the same way there was a drop down of immunization due to the ignorance and negligence of their parents and also lack of knowledge and information to the caregivers regarding the importance of immunization was there. So then only the medical professionals have decided to isolate the pediatric nursing care from the general nursing care. So we are more concentrating on the preventive pediatrics in both antenatal aspects and postnatal aspects. So once the partners are choosing to get pregnant, from the day of the conception we are going to give the extra care to the pregnant mother in order to provide the healthy life of the baby from the 0th day of conception till the adolescence age. For each and every age group have their own treatment modalities, nutritional surveillance, growth monitoring, immunizations and prevention of infections by opting some of the strategies. And also we are concentrating on the pediatric populations in order to reduce the increased mortality and morbidity rate and also to improve the immunization status in the children, that is at least the mandatory immunizations being stipulated by the national immunization schedule has to be implemented to all the students, that is all the children irrespective of their age and gender. So we are going to mainly focus on antenatal preventive pediatrics and postnatal preventive pediatrics. So antenatal we have seen from the 0th day of conception we are going to give the extra care to the mother and improve the health status. We will see one by one in detail. So pediatrics is a branch of medical science dealing with children. In many countries, mothers and children constitute approximately 59% of the populations. Prevention and health care of infants and children and adolescents is the core of the field of practice. So in this introduction, it is very clear that we are dealing with the branch of science and that is to the pediatric populations. Why we are more concentrating on the children is because they are also one of the categories of the vulnerable population. So vulnerable population means they are more susceptible to all the infections and also they are more chance of getting into the accidents and more increased number of disease will be there, that is high in mortality and morbidity rate is there in the pediatric population. So for that purpose only we are more concentrating on the pediatric populations. So definition is, it is defined as prevention of disease and promotion of physical health, and we are not only concentrating on the promotion of physical health but also the mental and social well-being of the children with aim attaining a positive health. So our main intention is to attain the positive health by health promotion, health maintenance and health restoration. So we are opting some of the strategies to do the health promotion, that is a preventive measures to prevent some of the diseases. For example, diarrhea is there. If we do a proper cleaning and sterilization, proper hygienic measures and proper concentration on the food materials, we can avoid the disease condition, that is a health promotion. Next we'll see aspects of preventive pediatrics. So we have a growth monitoring, nutritional surveillance, promotion of breastfeeding, oral rehydration, immunization, regular health checkup, health education to the parents, motor vehicle safety, control of infectious disease, healthy mother and child services. So if we see the growth monitoring, so when a baby is born, from the 0th day, we will also tell the caregivers regarding the growth monitoring. For example, the baby's birth weight is about 2 kg. At 6 months of age, the baby's birth weight should get doubled, and at 1 year of age, it should get tripled. So if we consider their height, weight, anthropometric measurements, it is very easy for us to do the growth monitoring of the child very easily. And each and every visit, we have to check the height and also the all anthropometric measures from head circumference to chest circumference to everything should be assessed to do a continuous monitoring of the child's health. Next is nutritional surveillance. So once the baby comes into the hospital only, we do the nutritional surveillance. It is very wrong concept. So when the baby is in the home, all the community nurses go to door and they will visit the baby and the lactating mothers and also the pregnant mothers and give all the nutritional supplements depending upon the baby's health conditions and mother's health conditions. So this is being practiced by our government, and they have taken various measures in doing this effectively in all the community areas. So by doing the nutritional surveillance, we can able to identify what deficiency the particular child is having, and also we can notify to the nearby public health center or tertiary care hospitals. And also the nutritional surveillance is done by a ABCD method. ABCD method means A is anthropometric measurements, B is biochemical investigations, C means clinical symptoms, and D is dietary management. So anthropometric measurement A means you will assess all the height, weight, length, mid-arm circumference, chest circumference, head circumference, everything will be assessed and it will be correlated with the normal value. And in the same way, biochemical investigations like blood test, everything will be assessed according to the disease condition. Then clinical symptoms, for particular disease condition they will be exhibiting some of the clinical symptoms. For example, if the baby is having anemia, means they will be having a brittle neck, easily pluckable of the hairs, pale conjunctiva, everything will be assessed. D is a dietary management. So far what the baby is consuming, a nutrition of the baby, that will be correlated with the recommended dietary allowance of that particular age, and they will give a modified diet to the baby to improve the nutrition status. Next is promotion of breastfeeding. So God has given a very good essential nutritional package, that is the breast milk, which contains abundant amount of antibodies, all the antibodies and immunoglobulins and vitamins, proteins, fats, everything is in a perfect amount. That is to be initiated by the mother to give the milk. And also the importance of colostrum is educated to all the caregivers, and also how it is going to improve the health status of the baby should be imparted to all the caregivers. Next is oral rehydration. So when you give a proper breastfeeding, when you give a continuous breastfeeding on demand, automatically we can prevent the dehydration in the babies. Next is immunization. You have to follow the national immunization schedule and you have to do the immunizations. That is, mandatory immunization should be given correctly according to their age. Next is regular health checkup. That is a continuous monitoring of the growth. Health education to parents. So health education to parent, which comprises of all these methods, that is growth monitoring, nutritional surveillance, promotion of breastfeeding, oral rehydration, everything will be given as a health education to the parents. Next is motor vehicle safety. So in motor vehicle safety, when you are taking the babies out, the baby will be very excited and very much interested in exploring the new things. So they will be running. So in order to prevent the motor vehicle accidents, we have to be very cautious in carrying of the babies in outside. And control of infectious disease. When you opt all the cleaning and sterilization, hygiene measures, you can automatically prevent the infectious disease being infected to the children. And next is healthy mother and child services. So nowadays, when we compare with the ancient times, but nowadays there are various measures has been taken by the government to have and to promote the health of the mother and also the health of the child by opting various health measures. Even in a public health center, we are having many services related to the mother and baby. That is, institutional care is given, regionalized care is given to the mother and baby. And regionalized care means we are having many pediatric hospitals. So if a baby is having any disease condition, means that baby can go and seek the medical intervention from the particular pediatric specialty hospitals, that is mainly considered for the pediatric population. And in the same way, in a control of infectious disease means if you see your toddler or your preschooler aged babies having any respiratory infections, you should avoid going the child to the schools in order to prevent the spreading of those infections to other children in the school. So these measures can be helpful in preventing the transmission of those infectious disease to other members from the schools. So these all are the aspects of preventive pediatrics. That is, you are going to prevent and you are going to monitor the health status of the baby in one by one. That is from growth monitoring. That is, growth monitoring is assessed once the baby is inside the womb itself. From the womb till the delivery of the baby and till the adolescence age group, we are concentrating on the preventive pediatrics. And in each and every age group, their own accidents are there, their own disease conditions are there, their own treatments, their own diagnostic modalities are there. So we have to concentrate more on that, and we have to do the prompt diagnosis and prompt treatment in order to prevent the further complications in the pediatric populations. And also nutritional surveillance is a very much important aspect in doing the one of the important components in preventive pediatrics. So that is, nutrition surveillance is not only surveying the nutrition status of the baby, but also depending upon the nutritional deficiency, we are going to give a nutritional supplementations. That is, if a baby is lacking of the protein, we will be giving a protein powders. If the baby's calcium status is affected, we will be more concentrating on the calcium levels. If they are more prone to some of the infections, we will give a referral to the nearby primary health centers or the tertiary care hospitals. So based on the need of the babies, and also we are not only concentrating on the babies but also the lactating mothers. When the lactating mother's health status is improved, automatically the babies who is getting breast milk from the mother will get the improved health status. And also the community health nurse concentrate on the pregnant mothers. When the mother is getting a healthy and 2 doses of TD and also protein supplements, when we concentrate on the pregnant mothers, automatically the babies inside the womb, their health status is also improved. So when we consider about the pediatric populations, we not only concentrate only when the baby comes to the hospitals, but from the 0th day of conception, we will be taking care of the babies from each and every aspect. So that is the aspects of preventive pediatrics. So once again we'll see, that is growth monitoring, nutritional surveillance, promotion of breastfeeding, oral rehydration, immunization, regular health checkup, health education to the parents, motor vehicle safety, that is prevention of any accidents in the children due to the enthusiastic and exploration behavior. Next, control of infectious diseases by adopting some of the preventive measures, that is using of mask or using of elbows while sneezing, everything. Then healthy mother and child services, that is being implemented by our government, as well as in many hospitals they are more concentrating on the mother and child services. That is, if a child is getting admitted into the hospitals, we are providing rooming in policy. That means the mother or the caregiver who is taking care of the child is also getting admitted into the hospital in order to prevent the fear in the children, and the baby will feel like as if the baby is in their home, that is away from home. So they will consider the hospital as their home if we allow the caregivers to take care of them in the hospitals during their treatment process, during their diagnosis process, or during any kind of interventions. For example, IM injection or subcutaneous injection, or when we do the measurement of anthropometric, the babies will have fear towards us. So while seeing our coats, white coats, while seeing our stethoscope, while seeing the sisters or the nurses with the injections and medications, they will have the fear. So nowadays we are managing many adaptive strategies to make the children to have a child oriented environment as well as the atraumatic environment, that is to prevent the falls in the children. So we are taking some of the measures to prevent the disease. That is, we all know like prevention is always better than cure. So before the occurrence of disease, we as a nurses has to take some of the measures to prevent the diseases. So we have the levels of preventive pediatrics. So levels of preventive pediatrics is comprises of 4 levels. That is primordial. Before the occurrence of the disease, you are going to give the education to the mother, but mainly we are discussing about only the 3 levels. That is primary levels of preventive pediatrics, secondary levels of preventive pediatrics, and the last is tertiary levels of preventive pediatrics. So we will see these levels of preventive pediatrics, and for each primary, secondary and tertiary level, they have their own goals. So we'll see about the goals of preventive pediatrics. First of all, we'll see about the primary. That is promote normal growth and development, develop parent-child relationship, prevent the occurrence of health problems, develop strength and resources. Next is secondary goals of preventive pediatrics is promote accurate diagnosis of existing health problem, facilitate treatment of existing health problem, eliminate existing health problem. And tertiary levels of preventive pediatrics, the goals are restore the function and prevent the recurrence of disease, prevent the further complications, and promote to adjustment to the chronic conditions. So we will see one by one in detail. So the goals of primary preventive pediatrics is we are going to promote the normal growth and development. So you must know what is a normal growth and development. As a nurses, we must have a knowledge on what is the normal growth and development of the pediatric population from the 0 days to adolescent. So they have their own milestones, fine motor skills, gross motor skills, and they have their psychological theory, psychosexual theory, intellectual theory, play, how the play will be. For each and every age group they have their own play. So play therapies are there. So you should know what is the normal growth and development. Then only you can identify is there any deviation from the normal growth and development is there or not. So for example, I am telling you, in infant, in 1 month the baby has to do social smile, and in 2nd month the baby has to do coos and vocalizes, and in the 3rd month the baby has to have a head control, and 4th month crawl, 5th month turnover, like that. So if there is a delay in that proper particular milestone, so we can identify, so there is some deviation in the normal health status, and you can identify the disease condition or any abnormalities early as possible and give the prompt treatment to the babies. So that we are automatically improving the health status of the child. And you have to develop the parent-child relationship. So once you witness the baby and child relationship, we have to promote the warmth and love and affection towards the baby from the parent side. Next is, so prevention of occurrence of health problems. So we know like prevention is better than cure. So before occurrence of any disease, you have to take a preventive measures. So before occurrence of, example I am telling you, before occurrence of diarrhea, you will take the preventive measures like cleaning and sterilization of feeding articles, proper hygienic measures during the preparation of the food, and always you prefer for the home cooked food. So these all will help you in prevention of occurrence of health problems, and develop the strength and resources. So nowadays we have many resources in order to promote the health status of the child, lactating mothers and pregnant mothers. So you have to adapt those services in free of cost from the government aspects. And in secondary, the promote the accurate diagnosis of existing health problem. For example, I am telling you, like one baby is coming into our hospital for some particular symptoms. For example, they are having a chest pain. Then you have to do the diagnosis based on that chest pain. You should not deviate from that diagnosis and do some other diagnosis which is not at all related to the conditions of the child. So when you do the proper diagnosis only, you can give the prompt treatment and prevent the further complication in the baby. So next is facilitate treatment of existing health problems. So for the existing health problems, you have to do a facilitation of all the services being given to the caregiver and the child. Next is eliminate existing health problem. So our main motive is to prevent the complications of the present health status. So you have to make sure that you are going to give the prompt treatment, and you are going to discharge the baby from the hospitals from the long stay. And the goals of secondary next is tertiary preventive pediatrics. Goals of tertiary preventive pediatrics is restore the functions and prevent the recurrence of disease. We are going to prevent the further complications of that particular disease. That is the goals of tertiary preventive pediatrics. So next we are going to see the classifications of preventive pediatrics. So when we consider about the preventive pediatrics, it is mainly composed of antenatal aspect of preventive pediatrics and postnatal aspect of preventive pediatrics. So when we consider about the antenatal aspect of preventive pediatrics, we are mainly concerned on the pregnant mother. So once the partners have been decided to have a plan for the baby, means from the day of planning, you are going to give the prenatal vitamins to the mother and iron and folic acid supplementation to the mother in order to boost up the additional health of the mother. So when you boost up the health of the mother, automatically the baby who's going to get conceived into the mother's womb will have a healthy environment, and also they will have a healthy environment and increased number of survival rate. So that is known as antenatal aspect of preventive pediatrics. And also we will once the partners have confirmed their pregnancies, you will also give 2 doses of TD, and monthly monitoring of the mother will be done, and also monthly monitoring of the babies will be done by doing nuchal translucency scan, anomaly scan, and also Down syndrome profile investigations. Everything will be done for the mother in order to promote the health status of the baby. And also we will see that monthly checkup is then and at last trimester, that is about the 3rd trimester, you will be asking the mother to come for every week, so that prompt treatment and also prevent the further complications in the mother and the baby can be prevented. And in postnatal aspect of preventive pediatrics, we are going to establish the clear airway, UPGAR score, care of cord, care of eye protection from infection, care of skin, prevent the hypothermia by providing warmth, and neonatal assessment is done for the baby. So once the baby is born, you are going to check all these criteria, and you are also going to do the UPGAR scoring management. So in UPGAR score, it comprises of activity, pulse, reflex, appearance, that is skin appearance, what is the color of the skin while crying, then respiration status of the baby will be assessed. So totally it is 10 points. The UPGAR score is assessed at 1 minute and 5 minutes of the baby is born. So at the baby after born, at 1 minute, what is the UPGAR score? Depending upon these all criteria, they will be giving the marks. And at 5 minutes of the birth, again how the body conditions have adapted to the external environment will be assessed. So next is preventive care of infant, toddler and neonate. For these all populations, the preventive pediatrics is same. So first is breastfeeding. So you are going to initiate and promote the breastfeeding as soon as possible the baby is born, and also you are going to prevent the prelactal feed. What is mean by prelactal feed? That means in ancient times and all, now also they are practicing, but now due to some additional informations by the healthcare providers and nurses give more information regarding the prelactal feeds, it is being vanishing day by day. So prelactal feed means a sugar solution which is being given to the baby once the baby is born. So if you are giving that high amount of sugar to the baby, what happens is their kidney and liver get damaged to the high concentration of sugar. So we have to avoid that. So you have to promote and initiate only the breast milk once the baby is born. Next, you have to start the weaning process. So once the baby establishes a 6 month of age group, along with breast milk, you are going to add upon a extra food. That is, if initially you will start with the liquids, that is soup, clear soups, or rice kanji soups, like that, waters like that. You are going to initiate those weaning process. So when the age progresses from 6 months of age, when the age progresses, you are going to increase the consistency of the food, that is from liquid to semi-solid, then solid. So based on the health status and age criteria, you will be starting the weaning process. Next is giving a nutritional supplement. Along with the foods, you are also going to give the nutritional supplement to the baby as well as the mother in order to improve the lactation and also improve the health status of the baby and child. And next is monitoring of growth and development. So when you go for the checkups in the hospitals for vaccination, you will do the height and weight checkup, anthropometric measurement checkup. So when you correlate those values of the babies with the normal value, then you will come to know what deficiency the baby is having, and you will also do the continuous monitoring. That is, when a baby is born, the birth weight has to get doubled by 6 months and tripled by 1 year. Like that criteria is there for the growth monitoring that you will assess. Next is immunization. So as per the national immunization schedule, you will vaccinate your babies accordingly, and from 0 dose to 6 weeks, 10 weeks, 14 weeks, 9 months, for each and everything the mandatory vaccine has to be implemented to the baby. How we can implement is, the nurses will either community nurse will go door to door step and give the information, and also the medical professionals will give the information through medias and advertisements. And next is safety and security of the child. Since the child are more prone to get accidents due to the enthusiastic and explorative behavior, we have to be cautious in safety and security of that child. Next is early detection and treatment of minor ailments. So even the minor ailments should be treated promptly to prevent the further complication. If you neglect those minor symptoms also, it can be a symptom of any other major disorder. So you have to treat those minor ailments also. Next is health supervision. So this will be done by the community health nurses, that is health supervision by continuous monitoring and nutritional surveillance and growth monitoring is done. Next is health education to parents. So health education to the parents, which comprises of everything, that is breastfeeding, weaning and nutritional supplements, about the growth monitoring and development, about the immunization, what are the importance of immunization, what are the ill effects of immunization if you don't give, and what are the advantages to the baby, mother and community, everything, and also the breastfeeding importance is the main purpose after immunization. So what is the purpose of giving breastfeeding, what are the nutritions that is being present in the breast milk, and what are the antibodies, immunoglobulins, and this is going to be the boost of immune power in the babies. This all has to be instructed to the caregiver by the nurses. And health education of the parents, which comprises of these all things, and you have to educate the parents. Once you educate the parents, only what happens, they will implement on their children. So they will have that conscious to have a continuous growth monitoring of the child, and also prevention of dehydration in the child. Once you see the baby is having a diarrhea or a losing of the fluids, that is vomiting, you should immediately seek the medical intervention to prevent the further complication in the children, and you should not wait till the symptoms get worsened. So once you see the symptoms, even the minor ailments should be taken care of. So this is the national immunization schedule being implemented. You have to see that all the immunization is being given to the children according to their age, from 0th dose to 6 weeks, 10 weeks, 14 weeks and everything. So next we are going to see about the main concept, that is prevention of accidents. So prevention of accidents in children is why? Because when you compare with the adult population, there is a more increased number of accidents in children due to various reasons, due to their exploratory behavior, everything. So we will see what are the common childhood accidents in the children. So one is falls, second is burns, then fracture and dislocation, sprain, cut and abrasions, animal bites, poisoning, drowning, motor vehicle accidents, foreign body aspirations and suffocations. So these all are the common childhood accidents in the children due to their enthusiastic behavior, and also they have a behavior of explorating the new things. So burns and all, if you are just praying in the home, so you are just lighting up the diyas or candles, so what happens, the baby will not have the past experience of how the burns will be. So when suddenly the baby will go and keep their hands or fingers, so they will have that ejection reflex. So that is the main concept. The baby will have a more exploratory interest on each and every object. So when you see about poisoning, like we will be keeping our toilet cleaners or bathroom cleaners near to the reach of the children, what happens, the baby will automatically they don't know what is that, they will drink that fluid. So there is a chance of going into this poisons. So causes of accidents is curiosity among the children, lack of supervision, lack of playground, lack of past experience, and inability to judge the danger. So there are some of the strategies to prevent the household accidents in toddlers, either toddlers or preschooler, the age group will be, but the preventive measures is same. So first is drugs and chemicals. So drugs and chemicals, how you can prevent is like you can prevent the medications being used by your grandparents or grandfathers or your fathers, can be kept out of reach of children. That is, if it is very easy to the proximity of the child will take that medicines and they don't know anything, they think that is a chocolate or everything, that is they will put on their mouth. So this is the behavior of the child, whatever they see outside they will suddenly explore it and put it in the mouth. So there is a chance of going into drugs and chemicals poisoning. So you have to prevent those drugs or chemicals out of reach of children. So next is car doors. So when you are taking the babies out in the cars, there is a child lock facilities there in the cars. So you have to implement that. You have to put the child lock while taking the babies to the cars. Next is electricity. So if there is a wires are there in your homes, means you have to prevent that wires is reach of children. Drowning and bathroom. That is, you have to prevent the bucket full of water in the bathrooms and prevent the child going into the bathroom. Next is aspiration of foreign body. So if a if the baby is playing with the toys, there is a small batteries will be there, so you have to very conscious in selecting the toys materials. So when you select the proper selection of the toys, you have to avoid the small parts in the toys, and you should see that the batteries are not very small to prevent the foreign body aspiration. Next is ingestion of lead. So if the baby is writing in the pencils, there is a chance the baby will bite those pencils and it will lead to the lead poisoning. So you have to be conscious while the baby is writing or scribbling or using any colors like that. Next is traffic. How you can prevent the traffic accidents is we have to very conscious while taking the babies into the roadside and prevent the baby running out, and because there will be various vehicles will be running, it is very difficult for the vehicles to put a sudden brake. So you should be very conscious and you should give the information to the caregivers that you should make additional efforts to prevent the accidents in the children in the roadside, and you should teach the children about the road traffic rules and regulations, everything. So this is in simple term preventive pediatrics. So far we have discussed about what is preventive pediatrics, what is the antenatal aspect of preventive pediatrics, and what is the postnatal aspect of preventive pediatrics. As a community health nurses, what we do a door-to-door investigation and assessment of the babies. So if you have any doubt, kindly drop down, and thank you for watching.